textbooks, dermatology, primary care. Throughout our lives, we will all interact with the healthcare system. So, what happens when that system is not designed with certain groups of people in mind? As a Black person in America, I have experienced firsthand racial disparities in healthcare. The turning point for me came during the pandemic when at a local clinic, I was asked if I had a red rash on my skin. At that point, it dawned on me that some healthcare professionals did not realize that skin rashes do not exhibit the same way on different skin pigmentations. If something so obvious could be so casually overlooked by a healthcare professional, what other elements of care, treatment, research, and education are also being ignored, and what does it mean for people of color using this healthcare system? I am Vivian Kopsinger-Birchall, and in this series, we will take a closer look at disparities in healthcare, speaking with medical professionals, and hearing personal stories to get a better understanding of those disparities and explore ideas and strategies for how to bridge the gaps.
Why is this important to you?
I'd say this is important to me because it's like spreading awareness for health disparities, not just here in America, but like globally, which is a really big deal considering the just massive gap between different continents and even countries. But also probably just the progress, like you see progress actually happening here when like I've come back twice now, right? So like things that they said were going to happen in the first time, like Calvin Johnson's company that he was launching, now those are actually happening and we're seeing them like right before us and their success, which is just awesome.
This is exciting. And what message would you have for our viewers about the whole Global Health Catalyst Summit and just engagement, and maybe specifically youth engagement?
I think it's just really important that we get into like new ideas and trying to interact with, like you said, the youth and inspire us and younger generations like the one you interviewed before to go into fields like this.
Absolutely. Again, thank you so much for coming.
It helps people who don't have access to the right medical equipment or medical information to be able to help people as much as a lot of places can. So it's just really important, and it makes the world a better place. Really just seeing these people from all around the world and just thinking, wow, there's like more people who care about this and it impacts so many lives.
Absolutely. And what is your vision going forward?
I hope that every place will be able to have access to a great amount of healthcare.
Oh, and what would you want to tell our viewers about healthcare? And anything.
I think that we should all work together to move forward to try and make a better world.
All right, take care. Thank you again for coming.
You're welcome.
Yeah, Global Health Catalyst has honestly been the most meaningful thing I've ever participated in, because I think that these aren't problems that can be solved without collectivity and mutuality, and those are two qualities that I've seen in this room more than I've seen in anything that I've participated in my journey to medical school. I think that a lot of efforts do tend to be more individualistic, and you hear like social determinant disparities, those terms are thrown around. But when people are truly like reaching out to each other and connecting, it's something that's so special to see, and you can really see progress unfolding that way.